I want to now bring in another audience member, Katie Needle from Brooklyn. Katie.
Hi.
Hey, Katie.
Planned Parenthood provides an array of vital health services for women, and the majority of their patients are on Medicaid. I'm a Medicaid enrollee, and I'm a Planned Parenthood patient, and I would be absolutely devastated if Planned Parenthood were defunded. We've already seen in Texas that cutting access to Planned Parenthood means women have less access to health care. More women's health centers didn't just magically appear because Planned Parenthood was defunded. That just doesn't happen. And I just want to call back, this wasn't part of my question, but I just want to call back because you earlier brought up Medicaid specifically and complained about how one of the biggest problems under Obamacare was that only a third of doctors were accepting Medicaid. This plan chooses to cut a provider that sees over a million Medicaid patients every year. So if that is your big problem with Obamacare, then how does that make any sense? That's not my question. My actual question is, how do you expect the millions of low-income women nationwide who depend on Planned Parenthood for these vital human services, basic needs, to access these things if Planned Parenthood is defunded?
Yeah, this is an important question because the fact of the matter is that the American people have for decades said that they didn't want their tax dollars, their federal tax dollars, to be used for the provision of abortion services. And so what we have tried to do when I was in Congress and now with the administration is to respond to the desires of the American people in a way that answers their concerns. The fact of the matter is that what the bill does that is before Congress right now actually increases money for women's health services, and we do so by providing those monies through community health centers. There are over 13,000, if my number's correct, over 13,000 community health centers across this country, and they're in the hundreds of Planned Parenthood facilities. So what we're trying to do is respond to the American people and their concerns about having their tax dollars, federal tax dollars, used for the provision of abortion services, and make certain that women not only have more ability to get to a health center, but have more resources to be able to do so.
You know, I want to throw out a number, and that is 105 counties. 105 counties across the country have Planned Parenthood, and that is the only clinic offering a full range of contraceptive methods to women. So how are the women in those 105 counties going to access all of that?
Well, I'd be interested in the list that you have, because the numbers that we have, again, over 13,000 community health centers, and I'd be interested in the counties that don't have them. And the fact of the matter is that if the resources are available, then what will happen is that community health centers will spring up to provide services for individuals. In the meantime, there are other avenues to be able to get services for women. There are community health centers, there are county health centers and the like. But what we want to make certain is that we are responding to the concerns of the majority of the American people, that federal taxpayers' dollars are not used for the provision of abortion services.
I have to ask you a follow-up on that in 1 second, but how are these community health clinics going to pop up in all of these places that currently the people are just relying on Planned Parenthood? Do you really feel confident that that's going to happen? Well,
again, I'd be interested in the counties that you have. I haven't seen that, so I'd be interested in looking at that. If that is indeed the case, then we'd be happy to take a look at it and see how to best provide those services. What we want to make certain, again, is that we're not looking at the amount of resources going in, but what kind of care people are receiving. And the fact of the matter is, we believe that the women of this land are able to receive the kind of services that they need, can receive the kind of services that they need through the community health centers, and we're providing more resources for them.
And real quick, because you mentioned the abortion issue a couple of times, is it not true that since 1977, the Hyde Amendment, when that first went into effect, it is not legal to spend federal taxpayer dollars on abortions already? So describe how it's an issue, because even Planned Parenthood isn't allowed to use federal funding for abortions.
As you know, and all these good economists in the audience know, that money's fungible.
That is true.
And so if you're spending money in one place and you move money to another place, then in fact you are indeed using that money. And again, the majority of the American people feel strongly about this.
Thank you so much.
Yeah.
We do have a lot more. We'll give it to you.
I want you to stand by.